While Cuba's army of white gowns are here to bolster efforts to curb the further spread of the coronavirus.
We are benefiting from the great strides that Utatu Nelson Mandela made for our country. We are going to spread them throughout the country so that they can bolster the efforts that our really courageous health professionals and health workers are making in fighting this pandemic. So we are truly, truly elated and excited that the Cuban health workers are here.
While Cuba's assistance has been hailed by most, there have been some calls for government not to overlook unemployed nurses and doctors.
We think it's a gesture that they are giving to us, and we appreciate the initiative by government. It's very much welcome. The however part is on the other side of the same coin, where we are saying the South African health professionals that are currently unemployed, some of which are doctors who completed community service at the end of the year last year, and in January they were told there's no employment. Those doctors still want employment, those who are still unemployed. Some are in private practice, but they wanted to work for government.
It's an extraordinary intervention. It's not in the normal course of doing things. We understand the issue of unemployed professionals in the country, the matter we've been raising ourselves. We do know that government the past few weeks had advertised posts as part of also mobilizing more health professionals inside the country to join the existing workforce in the fight against this COVID-19. But also, it's an important thing to bring specialists, from other countries, in particular Cuba.
While details of the Cuban team's deployment to different provinces are yet to be made clear, but the South African Medical Association, which has more than 60,000 members, says their arrival is premature and that the country should first exhaust all skills locally before asking for outside assistance.
We've got a lot of doctors that is retired and above the age of 60, 65 with a lot of clinical experience that would gladly be able to assist, and also training for those young doctors who lack maybe experience in the clinical field and mentoring them. And also with the nursing staff, if we can first use our own internal people and doctors, then once you exhausted that and you see that there is a need, then you bring in other people from outside. It doesn't matter whether it's Cubans or any other doctor.
The association says the decision was made without consulting medical associations. Criselda Lewis, SABC News in Johannesburg.